referral cases from not only within the region, but from other regions. I would like to take this opportunity to commend the management and staff of the hospital for their dedicated and selfless service, which has seen the facility play its role as an important secondary referral center in the region. But for this hospital, the region would have been severely challenged in managing the COVID-19 cases, as nearly all severely ill cases have been managed in that facility. Dr. Chairman, invited guests, ladies and gentlemen, permit me to highlight some of the achievements and some key indicators. The region, for the first time, recorded less proportion of teenage pregnancy than the national average of 12. Teenage pregnancy reduced from 13.5 in 2019 to 11.9 in the year under review. Antenatal coverage improved from 84% in 2019 to 88.4 during the period under review. Scale delivery has increased marginally from 70.5 to 71.1. Postnatal coverage also increased from 71.7 to 92%. Institutional neonatal mortality rate declined marginally from 8.6 per thousand live birth to 7.5 per thousand live birth. And still birth rate also declined from 12.6 to 11%. On EPI, pediatric coverage increased from 80.4 to 83.3, and measles rubella vaccination coverage increased from 79.5 to 92.2. ARG coverage also increased from 79.5 to 92.2, and TB case notification rate increased marginally from 34.1 to 36.8. The following indicators, however, saw a decline during the year at 82.3 to 80.9. Per capita OPD attendance declined from 1.2 to 1 during the year under review, and institutional all-cause mortality rate increased from 14.9 during the review. Maternal mortality ratio increased from 74.9 to 92.7 per 100,000 live birth. And institutional malaria under 5 case fatality rate also increased from 0.1% to 0.3%. From the foregoing, Dr. Chairman, it is clear that the region performed well despite the pandemic. However, more work needs to be done to reverse the trend in some of the indicators. This review meeting will provide a platform for us to discuss and address the key challenges confronting the service in the region. I'd like to use this platform to express our gratitude to the Honorable Regional Minister Designate, Hafiz Bin Saleh, for his continued support the service throughout the year. The Regional Coordinating Council, the municipal and district chief executives, our traditional authorities, the good people of the region have been unwavering in their support for the health service, particularly in our fight against COVID-19 and meningitis. I call upon the people of the region to continue to observe all the COVID-19 and meningitis prevention protocols to stem the two diseases out of the region. I urge all to embrace and take up the COVID-19 vaccine when our region gets its turn, because the vaccine is safe, efficacious, and prevents the spread of the disease. Our appreciation to the Director General of the Ghana Health Service and the Ghana Health Service Council for their support throughout the period. The press in the region has been very supportive of our cause. Indeed, you have provided us with your platform to engage our community and disseminate important messages to the people. I say, I echo. I wish to also acknowledge the contribution of our partners to the success of the health service in the region. UNICEF has been providing support for maternal and newborn care quality improvement, and also for promoting community participation in the running of the service in the region. The WHO country office supported the region to respond to the meningitis outbreak last year and for strengthening surveillance. Community Development Alliance is for supporting with health governance and accountability, HIV and TB control. JICA is providing support for strengthening community-based health planning services focusing on a life course approach. And AGAMAL is providing support for malaria control in the fight against COVID-19. Plan Ghana is supporting race communication, adolescent, and sexual reproductive health rights in the context of COVID-19. Impact Malaria is providing support for improving malaria case management, and they are also supporting this review meeting. Marie Stopes International is also supporting the area of family planning, and they are providing support for constructing a maternity unit in the Wild East District. Others are the former president of the National House of Chiefs, Togbe Afede. I don't know the number. It's Togbe Afede. The Vodafone Ghana Foundation, the Upper West branch of the Ghana Bar Association, the Freemason Group, Togo and Ghana chapter, which our chairman is proud member. The GCB Bank Limited and many others. We are very hopeful that you will once again stand with us this year in our efforts to deliver quality and accessible services to the people of the Upper West region. I welcome you once again to the 2020 Annual Performance Review meeting of the region. May we have frank, open, and passionate discussion. I thank you.
Thank you very much, Director. Shall we show him more love? Dr. Chair, with your permission, I would like to acknowledge some dignitaries that have joined us in the course of the program. We are joined by the Deputy Director, Human Resource, in the person of Mr. Zanu Dada. Can we see by hand? Okay, thank you. We have copied Adam Bere, he's the regional manager at Mary Stopes. Thank you for coming. We are also joined by Zoom by UNICEF and also JICA, and they are watching us by Zoom, and they would like to make some remarks when we get to partners and comment. We also have our Deputy Directors present. Can we see by hand at the Regional Health Directorate? Deputy Directors, Deputy Director Clinical Care, Deputy Director Finance, Deputy Director Public Health, Deputy Director Nursing Services. We also have the Chief Nursing Officer in our midst, in the person of Madam Ona Cecilia too. Thank you very much. Thank you. So acknowledge as and when other partners join us in the course of the program. Dr. Chair, with your permission, would like to take key message from the representative of the Director General, Ghana Health. Thank you very much. With a round of applause, let's welcome her to share with us message from the Ghana Health Service, Director of Ghana Health Service. Please show him some love. Show him some love.
My name is, good morning. My name is Eric Watling from Director General Audit, and also period for the region.
Make it first.
I present to you the Director General's message. Dr. Chairman, Rep of the Regional Minister, Rep one Director PPME and Goals Director, Deputy Directors, Team Headquarters, District Directors, Medical Director, Regional Hospital, Health Partners, colleague health workers, ladies and gentlemen. The Ghana Health Service uses the first quarter of every year as a period of taking stock of our progress made with respect to our service performance. This we usually do by assessing selected indicators from the Health Sector Medium-Term Development Plan, as well as other global targets such as the Sustainable Development Goals. Each year, all budget management centers of the Ghana Health Service are mandated to conduct performance reviews and report on their performance in line with good management practices. Reports from performance review eventually culminate in the production of annual reports of the service, which in turn feed into the performance assessment report of the health sector. As important as it is, we have all taken time off together here to deliberate on our regional performance for the year 2020. The most recent reform to our annual review activity has been the introduction of holistic assessment and peer review process at the regional level. Application of the holistic assessment tool yields findings that currently form the basis for the performance review discussions for all regional reviews. It is refreshing to see that the holistic assessment tool and process have gained widespread acceptance and recommendation by all. My heartfelt gratitude goes to UNICEF and USAID for their continual support that they offer for the activity. I wish to use this opportunity to encourage other development partners to come on board to support the regions to conduct peer reviews, health sector reviews. The Ghana Health Service has demonstrated its willingness to hold itself accountable to its stakeholders. I wish to make a brief but critical analysis of our collective achievement and chart a strategic way forward. I want to focus on three key areas. One, continuity of essential health service amidst COVID-19 pandemic. Two, health worker safety. And three, continuity of services during this period of COVID-19 pandemic. With increased national commitment towards ending preventable maternal and child deaths, the service recorded considerable progress in a number of key indicators in 2020, despite some service disruptions by COVID-19 pandemic. We observed a reduction in institutional maternal mortality ratio by 8.8%, with Ashanti region recording the highest drop of nearly 33.9% compared with its previous year's performance. Institutional infant mortality rate and total neonatal deaths reduced by 11.2% and 4.8% respectively. There was a 4.37 increase in ANC registrants, with the Upper West region recording the highest of about 9.53%. That notwithstanding, the service felt the impact of COVID-19 on some of its services indicators. Our available data as at 22nd February 2021 indicates that OPD attendance declined by 11% from 32,854,016 in 2019 to 29,202,381 in 2020. Total hospital admissions dropped by 6.03%, falling from a total of 1,774,813 in 2019 to 1,667,766 in 2020. The country also recorded a reduction in overall bed occupancy rate from 59.6% in 2019 to 48.1% in 2020. There was a decline in annual folk visit ANC performance of 1.51%, with the percentage of folk visit ANC clients dropping from 75.6% in 2019 to 74.4% in 2020. On the data collection front, we witnessed a decline in the completeness for most essential services indicators after May 2020 and a sharper decline in August and September 2020. Dr. Chairman, it is worrying to know that in the midst of COVID-19, we are also battling with stagnating situations in some of our health care efforts. Anemia in women and children continue to remain a huge challenge. The slow pace in the reduction of neonatal mortality rate constitutes a threat to efforts at achieving the SDG targets. The increasing burden of non-communicable diseases and the triple burden of malnutrition, including overweight, undernutrition, and micronutrient deficiencies, are equally major threats to our health efforts. Lastly, the spread of misinformation negatively affecting the health-seeking behaviors of the populace and the public perception of poor quality of care in our facilities, especially for emergencies, remain a worrying concern that the services needs to tackle. The service will address these challenges through scaling up health promotion interventions, revitalizing the main customer care to our clients, ensuring adherence to our code of ethics and protocols, ensuring availability of adequate and competent health staff, appropriate healthcare infrastructure, access to relevant health technologies, availability of reliable data to guide decision-making, and promotion of family and community involvement in health care delivery. We will also continue to pursue the broad vision of the service by ensuring that all communities have access to timely, quality, and comprehensive health care. In pursuance to this vision, I have been engaging with key directors and partners to look at the challenges and devise workable strategies that will help address them. While doing so, I wish to remind all regions of the significant challenges identified last year and the need to work seriously towards addressing them in order to make meaningful impacts in the short to medium term. Key among the challenges were poor emergency response system, data quality, completeness and utilization issues, low functioning facilities in the primary level, inequitable staff distribution, and IGF management and NHIA co-payment issues. Recommendation proposed to help address the challenges include, but not limited to, 1. Promotion of efforts and innovative actions to ensure the public and communities maximize the use of health facilities to generate more revenue. 2. Engagement of the National Service Secretariat and NAPCO for personnel in order to reduce the wage bills footed by the regional medical source and hospitals. 3. Rationalizing the use of IGF and identifying innovation to mitigate the effects of delayed payments from health insurance. 4. Improving capacity of all key managers in gyms to be able to make informed decisions guided by data. 5. Ensuring that the process of peer review, supportive supervision, and holistic assessment remain the key to drive quality and are linked to outcomes. 6. Ensuring fair distribution of critical staff across all regions through the creation of incentive package for officers who are posted to deprived areas. 7. Involving the senior staff in the hospitals in the work of the regional health administrations and district health administrations, especially on clinical care issues. 8. Involving training institutions in the capacity building activities of the regions. And 9. Exploring innovative and cost-effective ways of training managers on the district. Dr. Chairman, distinguished guests, ladies and gentlemen, permit me to give a brief update on the country's COVID-19 situation vis-a-vis our preparedness as a service towards tackling the menace. Since January this year, the country has unfortunately witnessed a steady rise in positivity rates of the virus. Overall positivity rate of samples tested between March 2020 and February 2021 is 9.2%. Enhanced contact tracing yielded a positive rate of 11.4%, while routine surveillance has recorded a positive rate of 10.9%. As at 15 February 2021, the total case counts to 78,689 with 568 deaths recorded. Currently, daily case count is about 500. I think we have the update. Now the case count is around 466 and the death rate is around 607 as at yesterday. As a service, we are working hand in hand with the Ministry of Health and partners to protect against further importation of the virus into the country and also to prevent in-country spread of the virus. We have in place comprehensive systems to prevent infection as well as handle identified cases in the country. Key amongst systems in place are trained port health staff to screen passengers at KIA, trained teams at Tema, Gan East and Rich Hospital to take care of suspected COVID-19 patients, continuous alerts sent to all regional directors of health that activated rapid responses teams for COVID-19, the revision of the National Influenza Pandemic Preparedness Plan with support from the WHO country office. Then procurement and distributed of several thousands of PPEs to MOH to DHS. The last not the least, activated thematic groups of national technical coordinating committees responsible for one, planning and coordination, surveillance, laboratory, case management, and risk communication. We shall continue to monitor the situation in the country and at our ports of entry. We will never relent in our efforts at providing guidance through health promotion, improving case detection through surveillance and intelligence, and responding to demand for care and case management. Dr. Chairman, permit me to express my profound gratitude to the Regional Coordinating Council, MDEs, our partners and individuals, the media, our gallant health workers, and more especially those working in extremely trying circumstances in the fight against COVID-19 in this region. I also thank our religious and community leaders, the private health sector, and other service delivery agencies, and all others who continue to support the healthcare delivery in this region. I'm optimistic that together we can improve our lot as service providers and transform the health sector into one that is capable of accomplishing its mandate to meet the aspirations of our clients and the general public. Briefly to conclude, Dr. Chairman, I wish to remind all of us that this is a time of great importance in our work as health workers, and I call upon all of us to accept the Herculean challenge of sustaining the fight against the COVID-19. Until the full rollout of the COVID-19 vaccines, we have to continue to protect ourselves, our families, and our communities. We must ensure that all protocols about COVID-19, including social distancing, the wearing of face masks, regular hand washing, and the use of alcohol-based hand sanitizers are fully respected. On a final note, as we gear up for the rollout of COVID-19 vaccines, I wish to urge all health workers to support the public education and the national campaign efforts to curb misinformation and rumors circulating around the vaccines. Thank you, and may the Almighty Lord guide our deliberations today as always. This ends the message for the Director General. Thank you very much.
Thank you very much, Mr. Prepo. The message is well delivered. Thank you. Dr. Chair, with your permission, we have a major item on our agenda, and that is to take solidarity messages from our partners. We have a number of partners in our midst, but because of time, we'll just take a few of them. And we'll take a message from Impact Malaria, another from Maristos, Ghana, then the third one from JICA headquarters, and that one will be done via Zoom. The health sector representative will join us via Zoom and deliver his message. We are also reminded, particularly from the concluding part of the director's representative, that we should all observe the COVID-19 protocols. Because of that, we made provision for sanitizers at the back. We have face masks. Those who have entered this hall without face masks, please get back to the secretariat table over there and get a mask to protect yourself. Thank you very much. So we'd like to invite Impact Malaria to give us a word. Please be very brief. We have just 5 minutes to do that. Thank you. Please welcome him with a round of applause.
Dr. Chairman, Regional Minister Rep, Regional Health Committee members, DCE, Regional Director of Health Services, reps of fellow health partners, traditional authorities, district directors of health services, medical superintendents, fellow health workers, invited media houses, ladies and gentlemen, I bring you warm greetings from the entire Impact Malaria family. The Chief of Party, Dr. Raphael Itumi, would have loved to be here with you, but other equally important and pressing engagements are taking him away, and so he has asked that I convey his special greetings to you with all apologies, and has requested that I give this brief goodwill message on his behalf. Impact Malaria is grateful to you for the invitation, and also excited to be here to participate in the 2020 annual performance of the Upper West region. In fact, we are very excited to celebrate your successes. Learn from President Special improve malaria services delivery across the continuum of care, from communities to health facilities in all 16 regions. It does so by strengthening diagnosis, treatment, and drug-based intervention for those at risk, particularly children and pregnant women. Over the past few months and years that we came to the region, distinguished ladies and gentlemen, the year 2021 marks the end of the year of implementation of the new sector health medium development plan for 2018 to 2021. This plan is designed to transition the health sector from the Millennium Development Goals to achieve the Sustainable Development Goals like Data General Rep indicates. Whilst the plan focuses on the SDGs, it also lays emphasis on the achievement of the universal health coverage. Ladies and gentlemen, as we strive to achieve the universal health coverage, we nevertheless encounter numerous challenges of recent and current challenges. It's the scourge of the COVID-19 pandemic that is affecting frontline health workers, both physically and emotionally. And health service delivery in general, I think much has been given to that from other previous remarks. Knowing the effect of this pandemic on service delivery has been critical to enable health managers map out appropriate strategies to sustain the gains that have been achieved and further improve on service indicators. We as health staff and health workers are pledged to improve the healthy lives of the people living in Ghana. And so we say your health is our concern. Therefore, COVID-19 or no COVID-19, we must deliver. It is for this reason that we find the theme of this review, the effect of COVID-19 on healthcare delivery in the Upper West region, very, very, very appropriate. And as a partner We think that any better team, there couldn't have been any much more better team than this particular one that has been chosen for this particular event. We salute you for choosing this team, and we are very confident that this meeting will discuss the performances of all PNCs dispassionately, so that you can arrive on positions that will help us move forward in the right direction in our common resolve to achieve our set targets and objectives amidst the COVID-19 and ultimately improve the health of people in the Upper West region. The PMI Impact Malaria Project will continue to cooperate with NNCP to support the region in the fight against malaria as we look forward to a stronger collaboration in the years ahead. On behalf of Impact Malaria, we wish you a successful review meeting and all the best for 2020 annual performance review of the Upper West region of Ghana. Thank you.
Thank you, Impact. They are one of our key sponsors for this program. Thank you very much. Please be informed that we have a live stream on Facebook, YouTube, and Zoom. So we take from Maristos. Maristos. Yeah, thank you very much. Thank you.
Good morning, everyone. Dr. Chairman, and representative from the regional minister, the regional health director, and all protocols observed. I've been quite off guard to give a word, and I will from my heart, because as far as I remember, we've been working with Upper West Region since 2015. Maristos is an organization that is into sexual and reproductive health care. Our prime aim is to improve family planning uptake, to also increase the contraceptive prevalence rates, and then reduce maternal mortality from unsafe abortions. In the past 5 to 6 years, we've been working together with Maristos under our evolving model, which is actually the public sector strengthening system, whereby we work with our partners to go into the facilities and build the capacity of the service providers to provide LATs, long-acting contraceptive methods. This has been going on for some time, and I believe this has been very successful in the region. As part of the projects that we run, we would normally give some logistical support. We will have capacity buildings, and recently, like the regional director just said, we had a sponsor coming in, being interested in one of our facilities in Wa, Logu Chips, and we are about finishing or completing the building of their Logu maternity home. You should give us a round of applause. Way forward for Maristos, we believe in a country where we should leave no one behind. We want to continue to strengthen the partnership we have with the private sector as well as the public sector. And we also believe in client-powered sexual reproductive health rights and education, ensuring that everyone has the right information to access family planning services. In recent times, we all know about COVID-19 that has hit us very hard. And during the presentation, I learned maternal mortality has actually increased, OPD attendance has declined. Some of these factors are COVID-19 because people are scared to go out into the community to access the right health services. What can we do as a region? I believe Upper West region, you have done very well. I entered here and I realized all the COVID-19 protocols are being observed. We need to be committed. So let's do. Aside that, we also need to be committed to the work that we do. We all know that we are working in the health sector, and we are definitely the first line staff that will be affected by COVID-19. So we need to ensure that once government has also given us the right vaccines to be taken, we all take part of these vaccines, which we have been informed are safe, efficacious, and also to curb COVID-19. For Upper West region, like I said, Maristos will continue to support as much as we can. We hope to reach out to many more districts to work with them. And we also want to say that we wish you the very best in your 2020 review. And we are hoping that in 2021, we'll be doing much better than we did in 2020. Thank you very much.
Thank you very much. I wonder if this speech was well organized. I was really like, thank you. The JICA Chiefs for Life project will speak on behalf of JICA headquarters. And so we'd like to invite Zaki Sabogo to deliver the message for JICA Ghana. Thank you, and then good morning to everybody. Dr. Chairman, representative of the regional minister, parents of the Upper West, director of PPME, you have opened your doors for us, team from headquarters, members from the high table, ladies and gentlemen. In fact, JICA Ghana viewed this particular review meeting very important. So they actually wanted to make a statement. Unfortunately, because of technology, they have to WhatsApp the statement to me to make on their behalf. So I will just read excerpts of it and then add my own voice. Like I mentioned, they are happy to join in your 2020 annual review meeting. Of course, JICA Ghana has supported Upper West region and the other 5 regions of the North in so many activities. First of them is the COVID-19. We have a package that we are supporting Ghana Health Service, the 5 regions to roll out. We are going to train over 1,500 community health officers in all the 5 regions. Upper West will get roughly around 400 CHOs being trained under that particular package for 2 days. We also have another package of PPEs that will be supporting the regions with. We also have another component of it that has to do with health education. So that component will also be rolled out in due course. So that is the package we have for COVID-19. The other important element has to do with the need to improve the medical equipment index of our various CHIP zones. JICA, through the various districts and the Regional Health Administration, have developed a package. I think all of us are very familiar with the equipment for the CHIP zones. We have the mobility equipment, we have the service delivery equipment, and then we have the comfort items. So within the service delivery equipment, we have selected 19 of the essential equipment that will be supplied to over 1,400 CHIP zones. The process has just begun, and I'm sure by mid-year, the equipment will be delivered at the various medical stores. We contacted the regions, and each region has identified one person. I think in Upper West here, the equipment manager has been identified to inspect the equipment when they are delivered before they are distributed to the various districts and the CHIP zones. The last but not the least is to talk about the effect of COVID-19 on our activities. Certainly, the project we are implementing is a technical cooperation, which requires that the Japanese experts should be available for us to be able to carry out certain interventions. In their absence, we will continue to carry out basic key interventions while we wait for them to come for us to continue with some of the key activities. I think all of you are familiar that we normally organize what we call JCC meetings, which is the main decision-making body of the project. In the absence of that, we rely on the various regions to organize what we call regional management meetings for us to take key decisions so that we'll roll out key interventions in the package. I think it's needless for me to talk about the project because we have been working with you. Without you, we can't actually do nothing. And we are proud to be part of this review meeting. And then I will sit in as and when it is necessary, I will make my input. Thank you for the opportunity. Thank you very much, JICA Ghana Chips for Life project. I'll add that most of the successes we chalked in chips in the Upper West region has been pioneered by the project. Thank you. At this moment, Thank you very much. We'd like to invite our Director, PPME, in the person of Dr. Alberta Richu Yanko, to give us some few words. With a round of applause, let's welcome her.
Thank you very much, MC. Sir Nana, Dr. Chair, please permit me to stand on existing protocols. Like Mary Stokes said, I didn't expect to make any remark, especially after the regional parent has also given us the word from the Director General. I think what is important for me to draw our attention to is the fact that anytime we sit to look at our data, the data has a history. The data has a history, and the history is that Ghana Health Service, or CHAD, we are implementers of policies that have been brought about by the Ministry of Health. So all we do is to implement these policies. The policies are turned into strategies, into objectives. The objectives are turned into plans, and then the activities that match these objectives are what we do. And therefore, every activity also has indicators. And it is these indicators that we review when we meet like this, looking at our data to see whether we are going as planned or not. But most of the time, though we are implementers of the policies, we do not know what the policies that govern the work we do are. Most people do not know the policies that govern the space within which they work. They work automatically. PPMBD this year is going to support all of us to look at the policies that govern the work that we do. Those that are obsolete, we are going to kick them out. Those that we have to fine-tune, we are going to fine-tune them. And then always try to link the policy to the indicator to the data. That will make us be very interested in data. That will help us to improve our data use for decision making. So I would say that please, let's look back at the policies that govern the workspace, and we shall come back to you. Thank you very much for your attention.
Thank you very much, Director. Shall we give her another round of applause? At this point, with the permission of the chair, we would like to briefly dissolve the high table. Nana Chair will go to that table with Director and the representative of the regional minister. Director PPME, Ghana Service Director General representative, the other partners on the high table will take the front seat here. Then we have Northeast region to come to account to us our stewardship for 2020. We were privileged in 2020 to have the Northeast region to assess us as to how well we are performing as a region. And Ghana Health Service has instituted what we call the holistic assessment. This is a comprehensive tool that is used to assess or appraise the health systems in each of the regions. And it's sort of peer assessment. And so it is not us saying the story, but Northeast will come and tell us how well or how bad we are doing. So we invite the team from Northeast to share with us how we are doing as a region. If the team is ready.
Isn't the presentation you gave me earlier?
Yes. You have a pointer? But the screen. It's appearing as Right.
Yes, I think we are now ready to take the presentation from Northeast. So let's welcome them with a round of applause. Thank you very much. Use the microphone again.
We shouldn't be seeing the next slide. It should be slide after slide. This one. Slide after slide. Next to this screen. Okay.
Good morning, ladies and gentlemen. I am Dr. Moses very much Martin. I am the Director in charge of public health for the Northeast region. And I'm here with one of our officers, the president of our sister Africa. Thank you very much. And our legal team, because of other that's why I'm about to hear out. So I go ahead with the presentation. So we were here doing a holistic assessment.
This is
And I will present to you the findings, which we didn't do alone as a team, but together with the Upper West Regional team. So my presentation will take this outline. I will do a very quick introduction and methodology, and we'll go to the real findings. So this was the team that came. Most very much, that's me. Mr. Yakub Mohammed is a deputy